This is the real challenge of treating a chronic disease like multiple myeloma that goes through subsequent periods of relapse and remission. And so we know that with each subsequent relapse, the disease becomes more resistant and evolves to resist treatment. So it's imperative for clinicians to be able to deliver novel therapies or novel combinations of those therapies to overcome that evolution that leads to disease and treatment resistance. So we're fortunate to be at a time in the field where we have several novel mechanisms, including bispecific antibodies, including 2 recent approvals, Teclistamab and Talquetamab, as well as CELMoDs, including Iberdomide, and so as well as CAR T cell therapy. So how we sequence these therapies is becoming clearer as we have more recent data showing the efficacy of these therapies in earlier lines of therapy. But it is really imperative for clinicians treating multiple myeloma to be able to deliver, the optimal treatment sequence to their patients, and that includes the evolving process of evaluating the patient, the disease itself, whether the patient may have high-risk disease or whether the disease is more sensitive to certain lines of therapy, as well as treatment variables, for example, the anticipated side effects of certain treatments. And we have to constantly reassess those for every individual patient as they progress through therapy. So the landscape is very much evolving, and we have novel drugs and novel treatment approaches, and we are making very strong headway in terms of how we prolong survival in this setting.